group pages, Aging in Place Network. So I welcome you. My name is Heather Brooks, and we have Amy Roberts as well as Eve Hill. We're just starting this group out, so we really appreciate it. And our whole point of this is to educate and empower everybody in the senior market and how to network. And I'm loving this. So welcome. I see Cindy just came in. So we've got about 9 people on the call. Amy, I'm going to turn it over to you.
Okay. Yes, I'm excited that we are all growing in this little community together and scratching each other's back. But Jennifer and I met a while back, and when we realized that our careers overlap some, I'm like, oh, we got to work on this because it's a layered effect that makes the end product even better. And so this is Jennifer Dalton. She wears many hats. She is an occupational therapist, a rehab care manager, a clinical liaison at Beyond Faith Home Care, which is a new startup in the San Antonio area. They have other areas too, but it's new in San Antonio. And so we all know what it's like to start a business and how much time it takes. And so she's very busy, but in her downtime, she likes to travel. She likes to go to the movies, and she loves her 4 little grandbabies. So she graduated from the University of Texas Health Science Center here in San Antonio back in 1998. And she's worked in various settings like the hospital, outpatient, workers' comp, home health in the San Antonio and surrounding Metroplex area. But she focuses primarily on the adult population, which makes her fit perfectly with us. So everybody, welcome to Jennifer.
Thank you very much, Amy. And I'm glad I did get to meet you, because every time I go to these networking events, I get to learn a little bit more about someone else that can help the seniors. And I wasn't aware of what the certification was that you all do, because in the home health field, we use the term aging in place all the time. So I was excited to learn what you all do and how you help people, because it is a unique position to be able to go into someone's home and help them stay there, or help them find a new home that will be their forever home so they can stay there. So that was exciting for me to learn about you and what you and your colleagues do. So I thank you for educating me on that. So what I thought I would do is start out talking about what home health is, because not everybody knows what home health is and how you qualify for it. And then I'll talk about specifically occupational therapy and what I do with my patients in the home. At any time, if someone has questions or wants me to re-explain something, please just hop in and speak up. I talk to people every day about all this, but I've never done it on video. So it's a little nerve-wracking for me just to be looking into the camera instead of having someone right across from me. So anyhow, I want to start off by just saying that I wish more people would take advantage of home health. It is free. If you are Medicare, traditional Medicare, home health services are free to you, and I cannot say that enough. So that means skilled nursing, PT, OT, speech, social workers coming into wherever your home is. It could be your own personal home, it could be a memory care, it could be an assisted living, an independent living facility, personal care home. We come to you and we provide these skilled services to you. You do have to qualify, and the qualifiers are set by Medicare. Number one, you have to be homebound, and that means, it doesn't mean bedbound. It doesn't mean you can't leave your home. It means it has to be difficult for you to leave home. It has to be a taxing effort. So you can still drive and go to the doctor, go get your groceries, go get your medications. You can go to church. You can go get your hair done. If you have plans to go meet the girls every Tuesday for luncheon, or you're going to meet for the poker game every Thursday afternoon, or bingo on such and such, we can't really qualify you as homebound. So again, the services for homebound do mean it's difficult. It's a taxing effort for you to leave home, or you leave home infrequently and only for very specific necessary items for you to be able to live. So that's number one, qualifying for the homebound status. In order for us to get a referral, it can come from several places. As I was telling the ladies earlier on the call, I just got a phone call from actually the family member of a current patient saying, hey, I've got someone else who's interested in home health. What can you do? What can you tell me about? So explain the whole thing there. And she just has to go to her doctor to get the referral. But usually we get our referrals from doctor's offices, hospitals, rehabs, assisted living facilities. May say we have someone who needs home health services. We'll get the doctor to write an order to us for home health services, and whatever clinician is needed, a nurse or therapist, and get their clinical notes that will qualify them as needing skilled services. And if their insurance is an insurance that particular home health agency can accept, then we can go out and do the start of care and do the services in their homes. So does anyone have questions up until this point?
I have a question.
Okay.
Do all home health cares have the same guidelines that they have to follow, or does each company make their own guidelines that they?
So all agencies have to follow the Medicare guidelines. So everyone has to, if you're qualifying for home health, you do have to be homebound. You do have to have that physician order and the clinical notes to be able to back it up.
Okay, thank you.
Sure.
We have quite a few different home cares around the area. We have like Alpha Home Care, Eden Home Care, Heart Song, all these different places that do home care. So I was just wondering if it was a standard policy.
It is. And every agency takes different insurances. I would say probably all of them take Medicare, and then different agencies will accept different Medicare replacement policies. So with the Medicare replacement, it could be WellMed, it could be Aetna, Blue Cross, Humana, all of those. Not every agency has a contract with them to be able to take those. If they do, it's just whatever that particular plan, that patient's plan has for coverage. So some of those insurances may have a copay. That's why I point out that traditional Medicare home health services are free. So everyone just has to look at their own policy and make sure before they sign up for anything, or that they know if there is going to be any charge going into it, or any copays or deductibles that they have to pay if it's not a traditional Medicare.
There is from the live feed on Facebook, we do have a question from Vince, and he said, you mentioned homebound by Medicare. Is there an income restriction as well?
No. In fact, I mean, we go into people's homes that I've been in 3-story homes that people have their own elevator. And I've been into people's homes that actually live in an RV or a shack behind the house with no running water. It does not make a difference. If they have traditional Medicare, does not matter what the income level is. We still will see you and treat you the same, whether you're the elevator house or the house with no running water. Everyone is the same and treated with the same respect, and we offer all the same services regardless.
Do you have to have a qualifying hospital stay though in order for Medicare to pay for it?
You do not.
Oh, really? Okay.
You do not. So as an example, let's say that you have a fall in your home and you are concerned about your own balance or your ability to stay in the home and prevent an injury. You can go to your own doctor and say, I've had a fall, I have some concerns, I feel weak. Can you make a recommendation for me to have home health services and have someone come to my home, have a PT come to my home and work with me? And then of course, they'll go through the questions to qualify you as homebound also. And then they can write a prescription and they can make a recommendation for a home health agency. Or if you have one, then you can say, I would like to have home health with such and such agency, but you don't have to have a hospital stay first.
Okay, thank you.
Of course. So as an occupational therapist, excuse me, when I get the referral, first off, our nurse would have gone in and done the admission and got them to sign all the consents. And then the therapy team will go out. As an OT, my job starts from the moment I pull up and I'm looking at the house. What does the grade of the driveway look? I look to see if they're going to get in a car, what's going to happen. Are they going to have a walker and it's going to be on a slope to try to get into the car? Are there steps? Are there steps going up to the front door? Does it have a handrail? Is it something that they may need a recommendation to have a ramp added or just a step ramp to be able to go up 1 or 2 steps? And then going into the home, just to take you through what like a home safety evaluation would be and what I'm looking at and recommendations. When we walk in, the first thing is when we're in the house, is there a front doormat? Does it need to be removed? Is it going to be a tripping hazard? Is there lighting in there? A lot of people, as we get older, we can't even reach the light bulbs. So they may have lights that need to be replaced. Going in through to their kitchen, are they safe to turn a stove on? What's their mobility like? I'm looking at how they can move and what their strength and their balance is. Can they bend down to pick up something out of a lower cabinet? Can they reach up higher to reach out pots and pans? Do we need to redesign it and have people keep things even sitting out on the counter? Do they have the cognition to even turn a stove on and off? And the big thing is making sure it stays off, or that they don't forget and leave a pan boiling on the stove and then having it start a fire. And then let's say going into the bedroom, everyone likes these high beds. I don't know why, but it's great if you have that mobility to get up and down on a bed, but not everyone stays the same height. I know, because I was just told I'm 2 inches shorter than what I thought I was. So does the person that you're evaluating have the safety and ability to get up into a bed? If they can't, then maybe we're looking at removing the box spring and lowering the bed down. Maybe it's a simple thing as adding a little bed handrail to be able to hold on while you're sitting on the side of the bed or getting in and out of the bed. Sometimes people think that having a hospital bed is fabulous. I tell you right now that the hospital beds that people order to have in their home are not comfortable, and they're not going to be the super expensive hospital beds that you may have when you're in the hospital. So as OTs, we go in and try to really look at their safety in and out of the bed. What might they need just to be able to safely get up in the middle of the night? We do lots of recommendations for lighting, especially because people get up and down at night. So we always want them to use their walkers if they're using walkers. Sometimes we will attach a bicycle headlamp to the front of the walker, or we have zip tied flashlights, so someone can click a button when they get up and then have the flashlight on, because if they have a spouse in there, they don't want to turn the light on and wake them up. They would sadly risk a fall instead of waking somebody else up. So we try to come up with little tricks to help people to remain safe and still be able to not get their spouse upset. A lot of times what we're looking at also in the bedroom is their accessibility to their clothing. If anyone has ever had an injury or even just strained a muscle and realized, okay, I cannot reach those clothes anymore in that lower drawer, what am I going to do? Sometimes it's a simple trick that we do is just pull everything from the bottom drawer. I tend to keep everything. I'm bad about going through my clothes and purging things, but I probably could get rid of a lot of my clothes. So with our clients, we'll go through with them and show them how they can put all their essential items that they normally wear during that season and put it in the top drawer so they don't have to bend over. We'll look at where they're sitting to get dressed and make recommendations on seating. Obviously, it's easier to get up from a seated position if you have two arms. So instead of having a low squishy chair with no arms, we may recommend even the dining room chair that has arms be moved into the bedroom and sit there to get dressed, to be able to, again, do it safely and independently. I was just speaking with someone about senior but independent living homes, and the big problem that a lot of these places have is that they're making them look very nice, but they're not fully accessible. So being able to have walking into the bathroom and getting in the shower, have a barrier-free shower would be an important thing over a step over shower, like with a glass door. So we're looking at accessibilities into your tub or your shower. Sometimes pulling down, not the patient, but having someone who could pull down the glass door and take that off and putting a shower curtain is safer than having a glass door if they need to have more accessibility, perhaps a wider doorway entrance into the shower. Or maybe we're using a tub transfer bench or a shower bench in the shower and they need to have something wider. So we're looking specifically at that. Even being in the shower, are they showering by themselves? Do they need to have a caregiver with them to be able to help clean them? So we're looking at accessibility for a second person to be able to stand in the doorway or be able to help bathe them that way, and their body mechanics and how they can reach the patient if the patient, let's say, is sitting on a shower chair. I know that you all probably are doing a lot of bathroom remodels or recommendations for aging in place. That is a big area because of the safety and the fall risk in there. So the removable shower heads through the years have become very popular, and it is a very useful thing that we recommend also. A simple thing like a Dollar Tree long-handled bath scrubby goes a long way, just to sit there and you have a long-handled shower scrubby so you can reach your feet and not have to bend over to be able to wash your feet. That's a helpful thing.
So I have a question.
Yes.
We do have a lot of real estate agents on here as well. And I guess one of the questions would be like, what if that aging in place, because there are homes that you can't age in place in. You just, it's going to be impossible. Like, do you know, how, as a real estate agent, do you connect with real estate agents, or how do you help? What do you say to a client if it isn't accessible, or how do you handle that kind of stuff?
Well, I'll tell you right now, I have most of my clients, they can't afford to move. So I guess I would, that's a challenge to me, Heather. What makes it not where you couldn't age in place?
Financials of not being able to fix a home, which
okay,
like that, you know, what if that 2-story home you couldn't put an elevator in because you know you've got permitting and you've got this and you have no bedroom and no bathroom on the first floor, and you can't even get it permitted for a bathroom or bedroom. That house you cannot live in that house. That's like how else are you going to get to a bathroom if you can't get upstairs, or you can't, you know?
So, well, I have not personally ever been in a home that doesn't have a bathroom on the first floor, but I will give you this. I've been in homes that have no shower on the first floor. And I do have, I mean, I have that situation all the time. And dining rooms are turned into bedrooms. The living room has a bed in it. So it kind of depends on how many people are in the home. I do have, you know, grandma moving in with the grandkids, adult grandkids, and they will put a bed in the dining room and this becomes grandma's room. No, there's not a shower, but as an OT, I'll tell you, as people age, they don't take showers, and that's not a bad thing because they do little sink wipe downs and just little sink baths. People get cold when they get older. And even though probably everyone who's on the call here takes a shower, it is not unheard of to have someone who's in their 80s and older say, I don't shower. I mean, I asked that during my evaluation. Show me where you take a shower. Show me how you bathe. And if you don't, and I always offer it first because people are embarrassed to say it. Do you not? You know, I don't say, oh my gosh, you don't take a shower. I say, how do you bathe? Are you in the shower? Are you doing sink baths? Are you doing such and such? And as soon as I make that suggestion, they say, oh, well, yes, I haven't showered in years. I had a fall, or I'm afraid of falling because I live alone. So I just do sink wipe downs. So we just make it happen in the home. And I'll tell you, if there are actually things that I have seen for people who don't have a shower in the home. I've been to one of my national conventions, and there was a vendor there that had like a temporary shower, and it was something that
Camping shower type thing?
Sort of like that, yes. And it's something that you could even roll a wheelchair onto and then set up with PVC pipe, put the curtain around, and you attach the hose to the kitchen sink. And there's your water source. And then the water would just be collected the same way and then go down your kitchen sink. So there are things to do. Because most of our people, truthfully, cannot make the expensive changes. The ones that I know that purposely want to make the modifications, they're doing it as they are a little bit younger and going through realtors like yourself to put those all in place before a stroke, before a heart attack, before they get so debilitated that they can't do anything or that they don't have the money to do it. So being able to work with your builders and being able to say, hey, we've got, you know, Mr. and Mrs. Jones, and they're looking for a house that they want to be able to age in place with. And these are the things we want to look at. Those that's the time to get it, to be able to do it, because it is expensive to make modifications. But in every town, they should be able to, the home health, or at least the OT or social worker, should be able to help direct your clients to some free things. So in San Antonio, we have an awesome nonprofit agency called Project Mend, and they take in donations from companies or gently used equipment, could be wheelchairs, hospital beds, walkers. They have all kinds of things. They sanitize it, and then they give it out to the community with a doctor's prescription, saying my patient needs a hospital bed, my patient needs a four-wheel walker. They can take that and they will provide that for them. So I'm sure every town has something like that. There's a lot of senior centers that I always connect our patients to, because they will have usually a medical closet where people in the community have donated their gently used items. Or sometimes people buy stuff and realize, oh, I don't really want this shower chair, I really needed a tub bench or something different, and they'll donate it. And so someone in that community can then go there and say, and ask to be able to use the same thing, and they'll give it out. So I always try to promote people going to look for those services, those nonprofits that can reach out and help our seniors so they don't have to pay for something else. Did I answer that question? Okay. So
I thank you very much for answering it. And you actually brought to my mind something that, as real estate agents that are on this, I know Terry was putting together when we were talking a newsletter, and that's like a really great thing to be able to put on a newsletter, because we all know that seniors love to information and education.
yes.
And it was something that we were talking about in educating, you know, in educating seniors and what's going on and in their community and with stuff like this. So to put little newsletters together for those of you on this call, you know, that it's a great idea to, when you're targeting the senior market, to find these types of services in your area and put them down there so they don't have to go looking for them. Because I got to tell you that what you were telling us about San Antonio, I didn't never have looked into anything like that, but it's interesting. I'm going to look into it in my area and see what kind of services we have that do that for people.
Right. Even places like food banks or your local Meals on Wheels, any home health agency. And you don't have to be signed up with someone to get information. We get calls all the time. I got a call today wanting to know the phone number for Meals on Wheels. Well, we're a home health agency. I have nothing to do with that, but not a big deal. Let me look up the number and give it to you. I have calls from people who want to know, how do they get equipment, or how do they qualify for something? And it might be that they actually are better serviced to having private duty caregivers, which we do too, and a lot of home healths do that. Where you can hire private pay caregivers to come in and sit with you or drive you to your appointments. That's a separate charge for that. That's totally different.
Yeah, there's a great network that it's called Village to Village that does stuff like that as well. Just going back to Facebook really fast, American Legion has hospital supplies on loan for people in need. So I don't know if people have American Legions by then, but if they do,
they're all over. Right. There's so many different resources out there. So, you know, people can call up in any city and to a home health agency and just say, hey, I need some help with resources. Do you know where I can get inexpensive medical equipment, or and also ask your primary care doctors. A lot of people think that Medicare covers hospital beds and all medical equipment, and it just doesn't. No insurance does. There are certain allowances for certain things like walkers and wheelchairs, but it's infrequent. It's like one every 5 years. So you really need to tap into your local communities to find out who can help with that. And senior centers are a big one because they do have that. And usually it's senior volunteers working there, and they will have even more information about things, whether it's meals or right now we've got out in the hill country here, we've got it's like a food sharing where different groups will come in. We have in our lower income areas, we have people who receive commodities. I'll be working in an apartment building, and a group will come in and bring tons of groceries in, you know, for all the residents to come share. So it's just a matter of connecting with whoever's in your community and finding that out. So go ahead, Eve.
Just there was a question in here which I just want to make sure that we answered. Does the client that paid a long time for long-term care qualify and need the doctor's order? It seems to me that you don't need your long-term care insurance to qualify for this, right?
You do not. We do not use long-term care insurance. Free, 100% free. If you have traditional Medicare, it's free. And most of the time it can be, I mean, they have a lot of the supplemental insurances or the Medicare Advantage plans, they have home health benefits, but you have to be in network. And then you may have co-pays with it. And that's not on the agency saying, we're going to charge you such and such because of this. This is the insurance setting the cost. But long-term care insurance, you don't have to use for home health. Save that for if you need to be in a rehab, or save it for long-term care, or save it for, it can qualify you to have private duty caregivers come in if you want someone to drive you or do light housekeeping or come give you medication reminders, that kind of thing. But you don't need to use long-term care insurance for home health.
Do you ever find that you're going to a place and a person is resisting having the services? That maybe they thought they needed something, they need more, but they don't want someone coming in. And do you have any?
I've been doing this for 23 years, and very few people refuse us. And that my number one thing when I go in with someone who seems a little bit hesitant is because they're afraid of a bill. They're afraid that they're going to get a big Medicare bill, and you know, their neighbor or their cousin told them they're going to get a big Medicare bill for this later, and it's going to be a surprise. So sometimes we just have to reassure them that they're not going to get a bill from us on this type of service. It is different from the hospital or a rehab stay. They may have to pay, you know, a 20% or something for those types of situations, but home health is not going to be billing them. Sometimes as an OT, I have to do a little song and dance and talk to people about what we do and why it's beneficial. Sometimes people will say, well, I can go to the bathroom, I can put my pants on, I don't need an OT. And I say, okay, well, have you, what are you having difficulties in? Because as an OT in the home specifically, we work with everyone to be able to do whatever their activities of daily living are. So I've written goals for people to learn how to retrieve their text messages or voicemails. I mean, how many times have you tried to call an older person and then you have to go over there and say, Mom, I've been calling you, or, Grandma, you didn't respond. And they say, well, I didn't know, and then it's a matter of, well, you just have it on mute by accident, or let me just show you. But we help people to relearn or teach a safer way to do laundry or do cooking, ordering their groceries online to be delivered. I have people in assisted living facilities who have been at the hospital and then come back, and the facilities say, if you can't, clean up after your pet, you're going to have to let little Fido go, and you can stay, but the dog can't. So we'll go in and teach them, how can you now safely clean up after your pet? Or how do you clean a litter box? But you have bending restrictions. That's just the uniqueness of being an occupational therapist. We try to modify your home or show you different ways of doing whatever it is that needs to get done, so you don't have that big change in life. You know, having an illness or an accident, that's traumatic in itself. But then you go in and say, you know, have someone say, well, you can't have your pet anymore. Or sometimes it might be adult children with that veiled threat of, if you can't do this, we're putting you in the nursing home. Well, we never want that. We want people to stay where they're at if they can do things safely. So we do everything between the nurses and the PTs and the OTs and the speech therapists and social workers. We do everything we can to keep them where they are, with the recommendations of whatever it is. So maybe it's a different way of medication reminders, you know, setting alarms on phones, having a family member call them if they live by themselves. We do lots of lists, lots of reminders, because sometimes it's just that visual. We all have busy lives. And then as we get older and do forget things, it's not bad to have, you know, have a list on your kitchen cabinet door, take your meds, you know, or having that alarm go off. So as far as going in and having that resistance to our services, number one, if they know it's free and we can convince them of that, fabulous. And then when they think they don't need our services, and we talk about, well, what we can do, and then we, you know, the proof is in the pudding, and we show them what we can do, and then we show them how safe they are, and how it allows them to show their family how they can stay in their home and stay safe, or they might not need the extra services of whatever someone might be recommending if they need to move somewhere else. That helps convince them to stay there. And then, you know, with COVID, it was tricky when it first came out, when it first hit all of us, because of course we're going in people's homes, and everyone did need to be very careful of where they were going. So pretty much that's the only time that I had people tell me, no, they don't want me in their home, was during COVID. But it was everyone just got used to us coming in with masks, or if we needed to come in gowns, you know, and show them we can be safe. We can keep you safe, and we'll keep ourselves safe. So it's, you know, when people get a referral for home health, it's usually because they want it. They know what we can do, and they're looking forward to us coming there rather than them spending the time and the energy to have to go out, like to an outpatient, or even into the doctor for extra nursing services or lab services. Our nurses will come and draw labs. We can order a mobile x-ray. You know, we do everything we can to make it convenient and healthy for the patient, stay right where they're at.
Can I ask you, since you've been doing this for quite a while, have you noticed in recent years any change or improvement in what Medicare is providing or agreeing to do, or has it always been so generous and free and available?
Well, I'll tell you, so most of the time I've been a clinician in the field, so I don't know the financial aspect on the backside, so I wouldn't be able to answer all of that. Equipment wise, I know, I mean, I don't think there's ever been a charge under Medicare, under traditional Medicare. At different times, I know they've covered things like bedside commodes. They don't cover that anymore unless, I mean, with some extreme cases, you know, if you are completely bedbound and unable to leave your bedroom even during the day, and there's non-accessible bathroom nearby, they'll pay for a bedside commode. That would take forever to get a doctor to get that prescription and get that covered by Medicare with all the justification, when I can go to my nonprofit and say, has anyone donated a bedside commode? I need one. or go to the senior center, and then I can get one within that week. Or I'll go through a durable medical equipment company, and every home health agency knows they've got partners in that field that they've worked with that can help offer equipment, or even going to a place as simple as Walmart.com. They have the same equipment, and they have usually the least expensive equipment. And it's the same brand as where you can buy it at a DME company or on Amazon.
But in terms of you offering your services, we can't find those discounted at a senior center. So your services are provided and they've been provided steadily by Medicare and home health. Yeah, that's great. It's a wonderful resource.
It is. And so as you all are looking at, well, let me ask you this. So are you working as realtors? Are you working with builders to perhaps modify a home that someone is building in order to have someone age in place?
It's interesting that you're asking that, because we have Louis Tenenbaum, who is on this phone call, and Susan Kimmel, and they actually are working on a bill for homeowners to help them with accessibility and putting money back in their pocket, with doing certain modifications. However, that will end up with the builders. So yes, as real estate agents, we really should be working with the builders and, other people in this industry to try to change the future of it. However, what do we do here and now? Because I will tell you, statistically, less than 10% of our nation's housing stock can actually accommodate somebody when they go into a walker or a wheelchair. So we all are going to accommodate our home, or I call it modify or move. You're going to have to modify it, or you're going to have to move out of it, one of the two. And if you're going to be modifying it, this bill, it's called HR 7676. It's a bipartisan bill. It is on the Senate floor. We're trying to get it through. But however, this bill would help homeowners across the board, everywhere across the nation, with tax credit, like a tax incentive, just like dishwashers and all, and all of this electrical stuff has the yellow sticker on it, certifying that it's energy efficient. They're trying to do what's like a purple tag, saying these are age-in-place products. They're going to help you in your home live safely. And so if you purchase these products, you'll get a little tax incentive off of it. Or if you do modifications within your home, construction-wise, it will help. So that's.
And also Amy is working, trying to get city ordinances. So then when they build the home, they will build them with the wood blocking, for instance, in the bathroom, so people can put grab bars in without having to do. So that would be, so that's what Amy's. Is there more about that?
It's part of SALSA.
Susan Kimmel, are you on?
I am. And, I think that we agree with you completely, and thank you so much for raising it, because there's so many, as you say, 10%, according to the Harvard study. I think it's only 1% have all 5 features that we can seem to be necessary, which includes things like a no-step entry, a curbless shower, having wide enough doors to get a wheelchair through. I mean, there are so many requirements, and having a bathing facilities and bathroom, meaning toileting on the main floor, main living space. So those kinds of requirements are very few and far between. And to make any of those changes under this HR, which is still in the House of Representatives, 7676, then you would be able to get a tax credit for the kinds of improvements that I've just mentioned. So it would be up to $10,000. So, it wouldn't cover everything, but it would certainly be a big help just to get started and make some of the improvements using your own funds. We hope to expand it in coming years so that it would reach more people. But I think just getting it passed and having it an IRS thing would be great. So tell your friends and neighbors, and Eve and Heather have already been promoting it for us. So thank you so much.
You're welcome. But the point is, we were talking, it is expensive.
Yeah.
You know, it's expensive. And to try and help the homeowner age in place successfully is all of our goal that's on this call, on the Facebook live feed, and who'll be watching it on YouTube over the coming years. But I'm glad that we're all here educating ourselves in each other's professions, but I love the connection that we're able to do.
Well, for sure. I think people only can age in place if they know they'll get the Medicare they need in their homes. I mean, you know, if they feel that they have to go out to the PT, they may not be able to manage. So knowing that many of these things can be brought to the home is an essential part of the planning that needs to go into making that decision.
Right. And it is.
Thank you. Yeah. You know,
So
this has
it's
been
very
very
important.
helpful.
It's very important for people such as yourselves and going to the networking groups and promoting this kind of thing, because it's not like it's advertised out there that that you can have home health services and that it's free. And a lot of the physicians don't know to offer it, or they don't know to ask the pertinent questions, or maybe the person themselves, they don't want to let the doctor know that they have a problem, because again, that might lead to them saying to a family member, oh, they need to move to an assisted living. Oh, they need to move out of their house. So they don't tend to tell people this. So the more people you can talk to, and it gets to your friends, your neighbors, your cousins, etc., out there, and they know, well, home health is free. We can come into your home and we can help you, and you can remain in your home. And that's the big thing that keeps us there, because they do appreciate the fact that we come work with them, and they can stay there and they can feel safe in their home.
Do you have anything if they have a cognitive impairment that you guys do to make it safer for them?
We do. And truthfully, so if someone has a major cognitive impairment, I would say they're not living alone. Maybe they have an elderly spouse with them that is able to help them safely stay there. But with certain people that live in their home and they're really not safe, like to cook, we will unplug the stove. We will make sure that Meals on Wheels are set up, or maybe they have a family member or neighbor that provides meals for them. So there are those kinds of safety things. You know, I could talk for hours just about certain occupational therapy things that we do. We work with people who are completely blind in the home. We can teach them how to cook safely, or how to be able to pick out their own clothes and actually have them match. So with cognitive impairment or dementia, Alzheimer's, we do lots, as OTs, we do a lot of teaching with caregivers on how to redirect and what to have in place when you need to redirect someone. If it's mild cognitive issues, again, lots of reminders. We do different types of alarms. If it's a minor impairment, maybe it's the the old-fashioned timers, the little twist timers that we would have on our stoves when you would cook. Okay, I'm gonna cook something. Well, we're gonna set it for 2 minutes. So where if you walk away and you forget, that loud alarm is gonna be buzzing off. So you'll know and remember to come back there to it. Or maybe it's if they're in the shower, we're recommending lots of safety and cognitive things there too. You can reset the hot water so it's not going to be as hot, because you don't want someone to get burned. There are safety buttons you can place around the house and push, just like the safety life alert type of necklaces. There are things that are buttons that you can put in the bathroom and have it down lower in case someone does have a fall, they're able to reach it and push it. So yes, all kinds of cognitive things and reminders, and our speech therapists work a lot with memory issues.
We are wrapping this up because we're about 10 minutes before we leave. So I would like to open it up to anybody that's here on the Zoom chat or on our live feed on Facebook, just to chime in if they have a question. Go for it. She's happy to answer things. If you need her information and you're living in Texas and San Antonio, please give her a call. Anybody? Nobody's popping out.
First of all, I'm in Texas, but I don't know how to contact you. Jennifer, I don't know how to contact you.
Okay. Amy, is there a way to put that up?
Can you put it in the chat?
Yes, we'll go ahead and get the information in the chat.
Jennifer.Dalton@beyondfaithhomecare.com.
Yes.
Is your email? Okay.
Yes.
Yeah, but I can't write that fast.
I was just checking. I'm going to put it in the chat. Don't put it in the chat.
Okay. That'd be great.
Yes, I mean, so anyone can reach out if they have questions. It doesn't matter what state you live in. I can still help answer questions or direct you to someone within your own state on who to
The
call.
company that she does work for is nationwide, so there are
Right.
places all over. I do suggest that in your in your back pocket to have an OT, because if you ever need one, they're going to come in really handy, whether it's you, a child, and an older adult. I mean, it's fine. And one that specifically deals in home care. I know you were talking about you're part of you were asking Amy, you were part of an association that you were talking to Amy about with health advisors. And I thought that was really interesting.
The case management.
The case manager.
The Alamo Area Case Management Association.
Yeah.
Right. So in every city, there's all kinds of things like our Alamo Area Home Care Council. It's a great networking opportunity in the area I'm at right here. There's like the Stone Oak Business Women's Association. They have those in every city, everywhere. And so those are really good things to join, whether it's the men's group, women's group, city council groups, everybody, networks with different seniors. So that would be a good thing to join.
And you can always start your own,
There you
in
go.
your area. There's not one.
You have given us so much information. And I got to tell you, there's a guy named Vince that's been that's talking on Facebook. And I got to tell you, he is just in awe over the information that he didn't know. And I got to be honest, I think a lot of us on here didn't really know that there were free things and what was free and what wasn't in what. But it's
Right.
eye-opening because as we all know, there's a lot of stuff going on in our own lives that I don't need to sit down and read all the fine print in my insurance plan.
Exactly.
Or forget about Medicare, Medicaid plans.
Exactly.
It's difficult enough. So to be able to have somebody be able to give us an easier version for us to understand is greatly appreciated.
Well, I appreciate you having me on.
When you talk about Medicare and you talk about traditional Medicare, and you said you can't have a supplemental policy, is that correct?
No, what I'm saying is that traditional Medicare will cover home health services at no cost. But sometimes you will maybe get an offer for a replacement plan. So, and I know you probably see commercials all the time for, well, if you have Medicare, but maybe you want to have less cost in let's say, medications or something, sign up and get an Aetna plan, a WellMed plan, one of these other plans. They do then offer some other perks, but it might mean it takes away your home health benefits.
Okay.
So it's really hard to know what you will need in the future. We don't have a crystal ball. So it's not like I will turn Medicare age and say, I'm going to have this plan because I don't think I'll ever have a stroke, or I'm not going to ever break a hip, and I'm not going to need home health services, or I'm not going to need such and such. Not every plan is the same, just like for any of your other hospital plans or rehab plans, what they pay for. So you just have to be very careful and ask questions. What will it cost? What will it cover? What will it not cover? And talk to friends who have both the supplemental plans and the traditional Medicare, and form an opinion that way, or ask a home health agency, or ask a hospital, if I have to come in here for surgery, what's it going to cover? You just have to be informed.
Thank you. I appreciate everything. We have 2 minutes, but I'm going to make a quick announcement because next Tuesday we have an amazing speaker, just like the one we had today, Fritzy Gross Stallion. She's the Director of Education and Advocacy at Age Safe America. She also happens to have been the National Association of Home Builders 2019 Educator of the Year. And she's building, she does teach courses, she educates, and everything else in aging in place. She's a national speaker, and she's written many books, like There's No Place Like My Home. An amazing woman. She was one of my educators.
She taught us our Certified of Aging in Place certification classes. So we learned from her.
And so she's changed the way I look at homes now. When I walk into a home, I was a real estate agent, and now I am better than just a real estate agent.
That's right.
It's amazing. So we are having her next Tuesday. She'll be here to talk to us and teach us all about aging in place and what it means and what she does for Age Safe America. So we're going to welcome her. From myself, Eve Hill, and Amy Roberts, we thank you for Aging in Place Network and joining us and our little group that we started a couple weeks ago, right?
Yes, it's really wonderful to hear all this information. It's so valuable.
Yes, very much so.
Is there anything else anyone wants to say?
Well, thank you everybody for joining us.
Yeah, thanks, guys.
And a special shout out to you and what you do. I appreciate all of the stuff that you taught us today. I really do.
That was needed information.
Yeah, I mean, and some of us really Vince was saying he wished he had this information when his mother was alive, because it's life-changing once you have it.
Right.
And I appreciate it. Thank you for joining us.
Well, thanks for having me.
Thank you, everybody.
Thank you. You did so good.
Thanks. Bye.
Good night.
Good night, everybody.
Good night. Thank you, Jennifer.
Thanks.